Is escalating, but the rate of prosecution is minimal. Medical aids are losing about 19 billion rand every year due to fraud.
The healthcare sector is worth about 296 billion rand, and most of the fraud occurs in the medical aid sector, which is valued at 140 billion rand. The Board of Healthcare Funders estimates that at least 10% of all medical claims in South Africa are fraudulent. This adds to about 400 rand per month to every principal member's medical aid contributions. The Board of Healthcare Funders is calling for more regulation to reduce the level of fraud.
I don't think the regulator, within this case the Council Medical Scheme, is doing enough for this. It can do enough of this if it can get more resources. You need more resources in terms of systems and processes and individuals that are adequately trained to track this down and obligate reporting on any kind of fraud that occurs. It is something that we feel the regulator has to invest in and do what it's supposed to do.
The fraud occurs across the board, from doctors to patients fraudulently claiming from the medical aid schemes, and service providers colluding with healthcare professionals. Still, consumers bear the brunt as they end up paying more for medical expenses.
The mere fact that you put it in as a percentage of the premium, then it means now that amount of money, it's, instead of being used for healthcare services or for healthcare cost, it's now used to actually fund something that is actually an irritant in the healthcare delivery model.
Experts agree that more regulation and stringent measures must be put in place to reduce the level of fraud in the healthcare sector ahead of the implementation of the National Health Insurance. Naledi Mudifi, SABC News, Johannesburg.